Sleep has immense power over our physical health. I'm Mindy Turner with the Curry County Cooperative Extension Service, your family and consumer science agent. For our series this month, we are talking about sleep and how important it is. Last time we talked a little bit just about the overview, how much sleep do we really need, some of the key things that it does for your body and for your mind. We're going to look at that a little more in depth as we go through the rest of the series. A lack of sleep doesn't just affect the day-to-day of our lives, but chronic sleep deprivation puts you at risk for a number of health problems. Because sleep deprivation suppresses our immune function and makes us more susceptible to bacteria and viruses, which we talked about last time, chronic sleep deprivation puts you at greater risk for health problems such as obesity, hypertension, heart disease, and mood disorders. What does it really look like? When we say that a lack of sleep affects us physically, what does that mean? Well, first of all, it alters your sympathetic nervous system activity. That doesn't sound good. It impairs our glucose tolerance. It alters our hormone levels, increases inflammation that impairs that immune system. So we can see overall, our immunity is less when we are not getting enough quality rest. It increases our risk for heart disease. It reduces the attention and cognitive functions in our brain, reduces our psychomotor speed, so we can't react as fast to things that are happening around us. This increases a risk of accidents and injuries that could happen. It compares to the impairment of excessive alcohol consumption. We gave some statistics last time to help you really put that into perspective. It causes memory lapses or loss, okay, which can also, I don't remember if I took my medication, and those types of things that can really become physical health issues. It increases symptoms of ADHD. It can lead to tremors and aches because you're just not getting enough sleep and your body doesn't have enough time to regenerate at night. It decreases your body temperature. And then it also increases that feeling overwhelmed, the symptoms of depression, the things that you're dealing with all around you. So there's a lot of things that happen in our body overnight that we physically need to stay healthy. That if we're not sleeping and we're not meeting that minimum requirement for what our body needs to rest and get rejuvenated, we can have significant health problems. So what about napping? Napping in the daytime may be recommended for those who have short nighttime sleep duration. Maybe that's because you have a job, you're working shift work. Maybe it's just been a rough couple of days. Maybe you're taking care of a toddler. All those things factor in. Sometimes older adults need that little extra kick of sleep. Or maybe if you're dealing with some type of a sleep disorder, which is a real thing, you might need to take that little bit of a nap during the day. For the most part, and for most of us, when we talk about what we need for sleep, because we need those rhythms and we need that entire process that happens overnight or during our sleep time. Maybe you work shift work and your sleep time is during the day. However that's set up, you need that full time. And so just napping for an hour here or there is not going to correct for all of those things. It's important to remember optimal duration for daytime naps is between 10 and 30 minutes. So like individuals who work shift work, like I mentioned a minute ago, you may benefit from 40 minutes to 2 hours or for that longer stretch of sleep because that's when you can get it. But the optimal time to take a nap is in the afternoon hours, and maybe if you are a shift worker, halfway between what your waking hours are for being at work. So that's just something to consider that, just because I take a nap and I take a nap during the day and then I don't sleep at night doesn't always correct for or allow for us to get the quality of sleep that we need. Sleep is extremely important to our health. Information for this series is coming from New Mexico State University Department of Extension, Family and Consumer Sciences, as well as the CDC. So you can see that it's good stuff that we need to know about our health and how sleep may affect that. I'm Mindy Turner with the Curry County Cooperative Extension Service. I hope you'll join us next time. We're going to talk a little bit more about how a lack of sleep may affect some of our behaviors as well.